So, students, today we will see milk fever, its etiology and clinical science. As you know, the milk fever is one of the most important metabolic disease, or it is also known as production disease. It is most commonly occurs within 72 hours of parturition in dairy animals, or shortly after calving. It is due to deficiency of calcium in the diet and is the main factor of milk fever. It is frequently found in high-yielding dairy animals. That is, high-yielding dairy animals or cows are mainly susceptible to milk fever, especially during third to fifth pregnancy or parturition. The milk fever it is manifested by hypocalcemia, general muscular weakness, depression, generalized paresis, recumbency, and circulatory collapse. So, students, as you know, the in milk fever or after calving, so there is milk production increases rapidly, and calcium is required for milk production. Lot of calcium is excreted through milk and colostrum, and there is more demand of calcium, that is about 1.3 gram per day per kg of calcium is excreted through the milk, and 2.3 gram per day per kg in colostrum. And therefore in dairy cows it will require, or it will secrete about 20 to 30 gram of calcium in the production of colostrum and milk in earlier stage of lactation. So this it is also required for development of the fetus during the last trimester of the pregnancy, and therefore so during a dry period about 50 gram per day calcium is required, and during lactation period about more than 100 gram per day of calcium is required, depending upon the production of the animals. And if the intake of calcium is poor, then there is mobilization of calcium from the body store, that is calcium is stored in the bones or skeletal. So there is negative calcium balance resulting to milk fever. So there are many etiological factors which are responsible for causing milk fever in dairy animals. As immediately after parturition, there is excessive loss of calcium, or excessive drainage of calcium in the colostrum and milk, then its absorption from the small intestine and mobilization from the bones to meet out the requirement of calcium. So there is a negative calcium balance resulting in milk fever. When there is an impairment of absorption of calcium from the intestine at perfusion is also one of the factor of milk fever. If the process of mobilization of calcium from storage is not efficient or rapid, or mobilization of calcium may not be sufficiently rapid to maintain the normal calcium level, it also causes milk fever. As you know, the vitamin D3 or vitamin D is very much important, and is required for and supports the absorption of calcium through the small intestines. If there is a deficiency of vitamin D3, then absorption of calcium from intestine is impaired. So this is one of the factor of responsible for deficiency of calcium in dairy animals. Then anion cation balance may also play important role and considered as an important risk factor in relation to the incidence of the milk fever. So it has been suggested that sodium and potassium rich diet, that is cation rich diets, increases the chances of development of milk fever in dairy animals. So this high dietary potassium and sodium leads to metabolic acidosis, alkalosis, and it reduces the bone and kidney responsiveness to parathyroid hormones. That is, parathyroid hormone is very much required, or it plays important role in the regulation of calcium level. So, on the other hand, the diet rich in anions, so it decreases the chances of development of the milk fever. as high anion containing acidic diets, which uh, helps in the mobilization of calcium from the bones. So that's why this the diet rich in anions decreases the chances of development of the milk fever, because of it helps in the mobilization of calcium from the bones. Then sometimes milk fever may also associated with hypocalcemia, hypophosphatemia, and hypomagnesemia. So high potassium in the diet, which increases the magnesium absorption across the rumen, and therefore this milk fever it is always associated with hypomagnesemia and hypophosphatemia. Now we will see the clinical signs of milk fever. There are three progressive stages of parturient paresis or milk fever. So in stage 1, that is during the stage 1, the animal is able to stand but show signs of hypersensitivity and excitability. There is tremors of the muscles of the hind limbs, particularly flanks and triceps muscles. So animal may appear restless and bellowing is there. There may be protrusion of the tongue and grinding of the teeth. So all these signs are seen in the stage 1 of milk fever. So during if the calcium therapy is not administered or it not initiated, cows will progress to stage 2. So in stage 2, the animal is unable to stand and rest on the sternum. There is sternal recumbency, there is smooth muscle paralysis, leads to gastrointestinal stasis, and which resulted into bloat. Then cows shows depression, anorexia, dry muscles, and also subnormal body temperature, cold extremities, dilated pupils. So all these signs are seen in stage 2. The animal rests head on the flanks. That is the typical postures of milk pure is seen in stage 2. That is S-shaped posture is the typical posture seen in milk pure. The auscultation of animals reveals tachycardia, decreased intensity of the heart sound, and there is weak pulse. So there is loss of anal sphincter tones also. So then stage 3. In stage 3, the animal loss consciousness progressively to coma. So animal goes in coma, unable to maintain sternal recumbency. There is lateral recumbency. So animal is placed the body in lateral recumbent. Animal becomes unresponsiveness to the stimuli, and the cardiac output worsens. Heart rate increases. It goes up to 120, and pulse may be undetectable. So if treatment is not given in this stage, the animal may die due to the cardiorespiratory failures. So these are the signs of the milk cures. So here we can see the some pictures. The animals in the sternal recumbency unable to stand after parturition. Then it is a typical posture of animals. The affected cattle just rest the head on the flank, that is head into the flank, and this is the typical S-shaped posture seen in milk fever. Thank you very much.